When it comes to talking about cancer, it may seem like almost everyone has a case of open mouth, insert foot. In general, these remarks fall into a couple of categories.
I knew someone with cancer. He went through a terrible time and then he died.
Thanks? I assume people are trying to connect when they say something like this, but it is not helpful in so many ways. Bless their hearts.
It could be worse. You're lucky they caught it early. You have nothing to worry about. Stay positive.
While these things might be true and the people saying them mean well, they're toxic positivity. Toxic positivity is when someone wants to force you to be more positive than you're ready to be. The funny thing is, when the person with cancer says these things, it's good and helpful, but when someone says them to the person with cancer, it can come across as belittling and dismissive. When a person with cancer says to me that a friend or family member doesn't understand, it usually turns out that the ally is being too positive in their attempts to reassure.
You are the strongest person I know.
Many people tell me that this frequently heard comment carries the hidden message that they have to stay strong at a time when they maybe don't feel that way. Allies, this comment tends to shut the door on conversations about how hard this experience is. Maybe they would like to lean on someone or express their fears or grief. Or here I'm talking to the person with cancer, not the allies. Maybe you're the patient and you don't want to have to be strong all the time, but you don't know how to stop saying, "Oh, I'm fine." Sometimes it helps to pick a person you feel safe being vulnerable with and start there. You may find that it's more okay for you to be not okay than you think.
Are you in remission? Is your treatment working?
Another tricky one. Innocent on the surface, but it can be really hard if the answer is no. People can sometimes ask for details the person just doesn't want to talk about, or at least not right at that moment. As either an ally facing other people's question or as a patient, it can be helpful to have a standard answer or two in your pocket for these occasions. Like, it's complicated. I don't want to talk about that right now. There's a lot going on, and then you change the subject. You should. Humans want to be helpful, but that impulse can lead to unsolicited advice. Most of us don't like unsolicited advice in general, but in the context of cancer, it can become absolutely overwhelming and very, very frustrating. Please don't give advice. If the person you know with cancer wants advice, they'll ask you for it. If you are the person with cancer, one answer that might help stop advice from others is, "I'm following my doctor's advice." Sometimes we don't know what to say. Sometimes we even avoid the subject or the person who has cancer because of this. Unfortunately, it may come across to the person with cancer that you don't care. They might be thinking that you've forgotten them or abandoned them. If you're talking to someone with cancer and you aren't sure what to say, simple is usually best. You might be listening to this and thinking, "Well, geez, what can I say?" You might be aware that you've said things like this in the past. It can be hard to know what to say. And if you're watching this as a person with cancer, you might be thinking that you don't mind people saying these things to you. People are different and take things differently. If you're watching this as an ally to a person with cancer, here's some things that might be more helpful to say to someone with cancer. If you want to talk, I want to listen. I want to help if I can. Is there anything I can help with? Or if you can think of any suggestions, make those. Can I help with meals or keeping you company or giving you a ride somewhere? Or, "I'm so sorry that you're going through this. What's next for you? How has this been for you? I'm thinking about you." Or, "I'm praying for you." Or, "I hope everything goes as well as it can." One important principle is to follow the lead of the person with cancer. If they want to talk, talk. If they want to sit quietly, sit quietly. Remember, no matter who you are, knowing what to say is difficult. We've all made mistakes. A little understanding about this goes a long way.